It is 3 a.m. You wake up. Again. You leave the warmth of your covers, place your feet on the cold floor, and walk in the dark to the bathroom. You stand there waiting. You strain and you wait, but the stream is weak and intermittent. It feels like your bladder never completely empties. Deep in your mind, while you stare at the bathroom tiles in the middle of the night, you know you will have to get up again in 2 hours. You go back to bed, but sleep is gone. Then the worrying starts, doesn't it? You believe this is just a part of getting older. You think it's the price of being a man. You feel that every man over 50 or 60 is destined to lose potency, lose sleep, and eventually end up on an operating table or dependent on drugs that kill his masculinity. I am here to tell you, looking right into your eyes, that this is a lie. I am Dr. Richard Powell, a urologist. I have treated thousands of men who thought their destiny was wearing adult diapers or accepting impotence as a fact of life. I will tell you something your doctor might never have had time to explain. The problem is not just the calendar. The problem is not merely how old you are. The real problem, the silent trigger keeping you up at night, might be sitting in your refrigerator right now. There is one specific food, something most health guidelines tell you to eat because it is supposedly healthy for your bones or heart, that is acting like rocket fuel for your prostate growth. It is like trying to put out a fire by pouring gasoline on it. In our conversation today, I will not give you generic advice like eat less and exercise more. I am going to expose the 3 great prostate villains. These are foods you consume, perhaps every single day, without realizing they are suffocating your masculinity. If you eliminate villain number 1, and I promise you will be surprised by what it is, you could potentially see drastic changes. You might even sleep through the night again within weeks. Let's skip the introductions and get straight to the point. Your time and your health cannot wait. Before I tell you what to take off your plate, you need to understand and visualize what is happening inside you, below your belt. I want you to imagine your prostate not as a boring gland only serving to cause cancer, but as a sponge. The prostate is a hormonal sponge. It absorbs whatever you put into your bloodstream. When you are young, this sponge is small, about the size of a walnut. It sits right below your bladder and wraps around the urine channel, the urethra, like a ring. Now think of a garden hose. Water needs to pass through it freely. Your prostate is the hand squeezing that hose. When this sponge becomes inflamed, when it grows, it is as if that hand is gripping the hose tightly. That is why your stream is weak. It is not that your bladder is faulty. It is that the exit door is being squashed. We call this benign prostatic hyperplasia. But why does it squeeze? Why does it grow? Conventional medicine often tells you that it just happens. I say that nothing in the body happens without a chemical signal. The majority of patients who walk into my office, strong, intelligent men, are unknowingly poisoning that sponge daily. They are creating an internal environment full of inflammation and runaway growth hormones. I have seen PSA levels, the marker that makes us fear cancer, drop drastically. I have seen men cancel scheduled surgeries, all by simply changing what went into their mouths. So let us talk about the culprits. Let us talk about what is inflaming this sponge. The third worst food, villain number 3, is what I call the inflammatory bomb. The sad thing is that you likely started eating this thinking you were taking care of your heart. I am talking about industrial vegetable oils and the fried foods cooked in them. This includes soybean, corn, canola, and sunflower oils. Perhaps you grew up hearing that butter and lard were bad. and that these clear, golden oils in plastic bottles were the modern solution. But here is the naked biochemistry. These oils are extremely rich in omega-6. When consumed excessively and out of balance with omega-3, omega-6 is pro-inflammatory. Imagine there is an inflammation thermostat inside your body. When you eat restaurant French fries, breaded chicken, or even industrial salad dressing made with soybean oil, you are cranking that thermostat to the max. You are creating a state of constant fire in your blood. Your prostate, being the sensitive sponge I mentioned, reacts to this fire. How does the body react to aggression? With swelling. Think about it. When you hit your finger in a door, it swells, turns red, and feels hot. That is inflammation. When you flood your system with these oxidized, inflammatory oils, your prostate swells up. They told you it was heart healthy. But the reality is that these oils are deadly to the prostate. If you have those plastic bottles of yellow oil in your pantry, I want you to do yourself a favor today. Throw them out. Do not donate them. Do not store them. Throw them away. The swap is simple. You do not have to suffer. Use extra virgin olive oil. Use avocado oil. Use real butter in moderation. Olive oil, specifically, contains compounds that help put out this fire instead of fueling it. This single change alone begins to loosen the hand's grip on the hose. Now, we need to go deeper. Villain number 2 is where most men lose the battle. This is the fertilizer. If the oils are the fire, this food is the fertilizer that causes tissue to grow disorderly. I am talking about sugar and refined carbohydrates. White bread, pasta, cakes, cookies, sodas, and even excessive sweet fruit juices. I need you to pay close attention here, because this is the scientific part that explains why so many men have problems today. When you eat sugar or white flour, your blood glucose level spikes. To prevent you from going into a diabetic coma, your body releases a hormone called insulin. Everyone has heard of insulin because of diabetes. But insulin has a secret function that few people discuss. It is a growth factor. Think of insulin as a foreman shouting at a construction site. Build, grow, accumulate. Insulin signals to the cells in your body that a lot of energy is available and it is time to grow. In a child, this is great. In a 60-year-old man, this is dangerous. When you have chronically high levels of insulin circulating in your blood because you eat bread in the morning, pasta at lunch, and a sweet treat in the afternoon, you are sending a constant message to your prostate cells. Grow. You are fertilizing the gland's expansion, and it gets worse. There is a terrifying correlation between obesity, diabetes, and aggressive prostate cancer. Cancer cells are addicted to sugar. They have many more insulin receptors than normal cells. Sugar is a tumor's preferred food source. Therefore, when I tell you to cut the sugar, it is not just so you can lose that belly. Though your waist will shrink and your testosterone will increase if you do this. It is about stopping the feeding of the enemy. I have to be tough with you now, like a mentor who cares. You cannot have a healthy prostate and a high-sugar diet at the same time. You have to choose one. Is the warm French roll with butter delicious? Yes. But is it worth waking up 5 times at night and being afraid every time your blood test results come in? I believe it is not. Now, we have reached the moment of truth. Villain number 1. This one is going to make a lot of people angry. It goes against everything your mother told you and everything television has told you for decades. It is the healthy imposter. If you want to protect your prostate from enlargement, and more importantly, if you want to reduce the risk of more serious issues, you need to eliminate commercial milk and excessive dairy products. I know. But doctor, what about calcium? What about my bones? Listen carefully. Cow's milk is a miraculous liquid designed by nature with one single purpose: to turn a 60-pound calf into a 600 to 1,200-pound bull as quickly as possible. Think about that. It is an explosive growth fluid. To make that calf grow so fast, milk is loaded with natural hormones and growth factors. The main one is called IGF-1, insulin-like growth factor type 1. Remember what I said about insulin? That it tells cells to grow? IGF-1 is like insulin, only much more potent for cell proliferation. When you, an adult man, drink glasses of milk, you are flooding your system with this bovine growth hormone. Your prostate is extremely sensitive to IGF-1. Large-scale studies show a strong link between high levels of IGF-1 in the blood and an increased risk of prostate cancer. We are not talking about a little aged cheese or an occasional fermented natural yogurt here. Fermentation breaks down some of these problems and adds probiotics. I'm talking about that glass of milk, the smoothie with milk, the cereal with milk, and the coffee with a lot of milk. Your body is not a calf. Your prostate does not need to grow larger. It needs to shrink. By drinking milk, you are giving it the exact chemical command to expand. Many patients tell me, "Doctor, I cut out milk and within 3 weeks the frequency of my bathroom visits was cut in half." That is the inflammation and hormonal stimulus going away. The dairy industry is powerful, and the marketing is strong. However, your body's biology does not lie. If you are fighting prostate growth, milk is gasoline on the fire. Try substituting it with unsweetened almond milk, coconut milk, or simply eliminate the habit. Your bones can get calcium from green leafy vegetables, sardines, almonds, and smart supplements. They can do this without the hormonal load that destroys your prostate. Now, you must be thinking, "Dr. Powell, you took away my bread, my milk, and my fried food. What is left? Am I going to live on light?" Calm down. This is where we turn the game around. I do not just want to take away the bad things. I want to give you the ammunition to rejuvenate that organ. I call this the antidote protocol. We are going to swap poison for medicine. If you want to protect your prostate, there are 3 things you should start consuming, if possible, today. First, the prostate shield, cooked tomatoes. Not raw tomato salad. The secret here is a substance called lycopene. Lycopene is a powerful antioxidant that accumulates in the prostate and protects the cell's DNA. But it is trapped inside a raw tomato. To release lycopene, you need heat and fat. Therefore, homemade tomato sauce made with olive oil is medicine in the form of food. Studies show that men who eat a lot of tomato sauce have significantly lower risks of prostate issues. Second, the reducer, pumpkin seeds. Your prostate is the organ in your body that concentrates the most zinc. Zinc is crucial for sperm health and for maintaining the prostate at the correct size. If you are zinc deficient, the prostate suffers. Pumpkin seeds are natural zinc bombs. Have a handful per day. It is simple, cheap, and effective. Third, the cleanser, green tea or pomegranate juice. Green tea contains catechins, specifically one called EGCG, which helps induce the death of bad cells that want to overgrow. It is like a cleanup crew sweeping away cellular waste. Look, I know that changing habits after decades is difficult. You have been conditioned to eat and live a certain way. But the discomfort of change is infinitely less than the pain of serious illness or the humiliation of losing your independence and virility. You are not a victim of your genetics. You are not a victim of your age. You are in control with every forkful you take. Your biology responds to what you do. Start today. Remove the vegetable oils. Drastically reduce the sugar. Cut out cow's milk. Begin introducing these protective foods. Give your body a chance to heal itself. Give yourself the gift of an uninterrupted night's sleep. You deserve it. If you want to know exactly what I do, my complete morning protocol for keeping testosterone high and the prostate shielded step by step, click on the video that will appear on the screen now. Do not let your biology defeat you. I will see you there.